We're going to demonstrate accessing into a patient using Seldinger technique. For this portion of the demonstration, I'm going to pretend that I'm the physician, not the scrub assistant. And we're going to pretend that this is the patient access site, whether that be IJ, radial, femoral, percutaneous. This side of the green line is the patient, and then here is the demonstration of our sterile tray. Physicians can access by themselves, so I'm going to demonstrate as if I was working by myself, and then I'm going to interject at points and say where you as a scrub assistant might be helping in a case if you were scrubbed beside. Okay, let's begin. Okay, so this is how we gain access using Seldinger technique, whether that be radial, femoral, IJ, the technique is the same no matter the part of the body. So the physician will have an ultrasound probe in their hand. I don't have one, I'm just representing it with an ultrasound probe pack, but they would be ultrasounding and checking for the blood vessel or the structure that they want to get into. And the first thing that they would do once they've targeted their blood vessel is lidocaine. So they would infiltrate the site to numb it, and this is when you need to have your sharps bucket handy for the radiologist so that they can put the sharps directly in. Some physicians will choose to make a little bit of a skin nick, and once again, when they're done that, they'll place that into the sharps bucket. Some physicians will choose to do a little bit of a dissection to loosen the skin around this nick that they've made, and then they can place that aside. And then this is the part where if you are a scrub assistant that you can get the wire and the sheath ready. If a physician is working by themselves, they will just get it ready by placing it close to them, by having the wire straightened out using the cheater if that is something that they need, and having the sheath ready to go, everything within reaching distance. So they're ultrasounding. Once they find the vessel, they'll puncture in with their access needle. And at this point, if they see some blood coming back and they see that they're in the target vessel, they'll lay the ultrasound aside and put in the wire. The wire will be used to maintain the place inside the blood vessel, and then at this point, the needle can come out. We can see that the wire is maintaining our place. This is a little bit awkward to do, so you can see if I'm working alone as a physician that I would be able to do it by myself, but if there is a scrub assistant to help, what you could do at this point is help thread the sheath onto the wire for the physician. So again, working by myself, I will just have to try and manage alone. The reason that they're doing this one-handed is because they never want to lose access into the hole, into the blood vessel, or into the tubular structure that they've made. So they need to try and thread the sheath onto the wire one-handed. So if you can assist at this portion, that's helpful. So they'll thread the sheath on and then push it into the patient. So once your sheath is in, the wire and the inner dilator come out. The purpose of the wire was to guide our way into the tubular structure or blood vessel, and the purpose of the dilator was to smooth our entry into it, and these can now be set aside and shouldn't be used for the rest of the case. And now we have our access because we have our vascular sheath.